Welcome back. It's a disease that 15% of adults in America struggle with, but you may not even know you have it until you start feeling leg pains or having some type of skin problem. Well, this morning, our next guest is here to tell us about venous disease. Please help me welcome back to the show interventional cardiologist, Dr. Ahmad Jabbar, who works with the Cardiovascular Institute of the South. Welcome back to the show, doctor.
Thanks for having me again.
Thanks so much for coming on. Really interesting what we were talking about last time. This time we want to focus on venous disease. Please tell us all what venous disease is and how does someone acquire this?
So, venous disease, we're talking about something called venous insufficiency, which is the inability of the veins themselves to allow blood to move back towards the heart. The arteries are what we call the high pressure system that sends blood that's oxygenated to the tissue, and that blood then circulates back through the low pressure system, which are the veins, to the heart. Now, sometimes for various reasons, those veins lose their ability to work properly, mostly because their valves, which is a conduit that allows the blood to not leak back, don't work properly. And when that happens, those veins tend to swell up because the blood sits in the veins, or they can create varicose veins, which are basically enlarged veins that can be a connection between other veins where the blood's just not moving properly. And that can lead to problems with time. And it could happen for various reasons. Most often, one of the most common things is pregnant women tend to develop this because of hormonal changes and weight changes. And that puts pressure on the lower extremities and the ability of those veins to move blood back towards the heart. But it could happen for other reasons also.
Very interesting. You know, there are so many different symptoms when it comes to venous disease. Varicose veins, spider veins are some of those most common, symptoms. What are some of the other ones?
So, most commonly, usually, is swelling or the visibility of those varicose veins, but you can have things like discoloration in the skin from the pooling of the blood in the veins. Sometimes you can have leg pain, mostly around the ankles, I tend to see, or cramping. Some people just have restless leg at night. That's the only symptom they have, and they don't even realize that that could be related to venous insufficiency. And then as it progresses, and that doesn't always happen, but for some people, from the venous insufficiency being so bad, they develop such bad swelling in their legs that they could eventually develop leg ulcers, and that's when it gets really dangerous.
So this is when we need to really say, okay, I may have these varicose veins, but I'm starting to see leg ulcers, I'm starting to swell. That's when we then say, I need to go and see a cardiologist because I have friends who have like varicose veins and they walk just fine, they feel no pain. But when it comes to these symptoms, that's when we need to go and say, okay, time to go make an appointment.
So I would say it varies for different people. For example, a lot of my patients are people who have jobs where they're on their feet all the time, and their symptoms get so bad to where it's mostly pain that's bothering them. So I would say if you're having symptoms such as swelling or significant pain or any of those symptoms that are actually affecting your activities of daily living or your ability to work, then you should seek treatment. I wouldn't wait until it gets to the point where it's an ulcer. I definitely would seek treatment if you develop an ulcer, but you sometimes want to, no one wants to live with pain or discomfort, and you can treat that before it gets to that point.
So important to note right there. How is venous disease treated? Does it need to be treated? If so, what treatments are available?
So, majority of people, like you said, they may have a couple of varicose veins and they're fine. It's mostly cosmetic. They're like, hey, it's fine. It doesn't bother me. And that's perfectly normal. You don't need to treat those things. It's not at that point a life threatening issue. The most common thing we do is we tell people, especially if they have swelling, to try to avoid high salt diets, right? Or some people, if they have high blood pressure and swelling, they may need to be on a diuretic medicine, which is a medicine that allows to lose fluid that they can increase their swelling. But most commonly, we have people wear compression stockings, and that tends to work just fine. The compression stockings allow those veins to basically have the blood circulate back up to the heart, similar to the way the calf muscles naturally compress your veins and allow the blood to move back. Now, if you try those things and you still have problems, persistent pain, or if you have persistent swelling, or if worst case scenario you have an ulcer, we have other treatment options such as ablation, which is basically heating up those superficial veins and burning them shut so that they are no longer a problem and no longer leading to issues. And then there are a couple other modalities that we use. We inject some sort of detergent material that we use that is a chemical that allows to shut down those veins. And believe it or not, there's even a form of chemical super glue that's safe to go inside your veins that shuts down those superficial veins. Again, these are treatment options for venous insufficiency and superficial veins. We don't treat the deep veins in this situation because, hey, you still need blood to go up to the heart.
That is true. And doctor, we're running out of time, but I have to ask this question. We're talking about venous disease this morning. Is it preventable? How can we not have this happen to us? Because when I think sitting down, right, I feel like, oh, that's going to cause these varicose veins. How can we prevent this from happening?
So I would say the biggest thing, is just like anything else, exercise is always helpful. Sometimes these things are hereditary and it could be genetic. So I'd hate to admit this, but there's probably no way to prevent it in that situation. But like you said, sitting down prolonged periods of time or standing for prolonged periods of time, finding a balance, right? If you have a job where you stand all the time, you may want to take a couple breaks every now and then, or wear compression stockings when you're working so that you help prevent that from happening. So even if you don't have varicose veins, depending on your job, you may need to wear compression stockings to prevent it from happening.
Some great tips this morning, doctor. I need to get up and move while we take this commercial break. Thank you so much for joining us this morning. Hey, for more information and tips on your heart health, visit cardio.com or give the Cardiovascular Institute a call at 504-354-5252. And you're seeing the address of the place on your screen.